Innovation, Pows, and bright ideas is the foundation of the work that gets done during CMI. That is absolutely necessary in order to begin to work as a team, continue to work as a team, continue to be innovative and try new things. This is not about having a policy and procedure that you're just given. And not that it can't turn into that, but this is about doing our work differently. Implementation can be done by anyone. Most of the bright ideas actually come from the staff. The providers being part of the team may have also a bright idea, and that team will work on that bright idea before it's spread to the other teams. I would say that once your teams are together, which is a bright idea in and of itself, clinics may choose to determine how they're going to create their teams. Once they're in teams, they are going to need to start with their bright ideas and their innovation thoughts and start working like a team. And I fully expect that to kick off within the first few days of the team being together. POW stands for Problem of the Week. When you work on a POW, it's typically surrounding efficiency and doing things a different way to make something better. What is our work to do? What do we want to be innovative about? What do we want to change? There's also a tool that's out there for those that have never done a POW before on having some safe kind of expectations surrounding when you're involved in a POW, what is my job? My job is to be collaborative. My job is to try, be willing to try, and be willing to fail, because that will happen and it's okay. Prior to CMI, the patient would be scheduled for a visit prior to surgery. Many times they would forget their forms, so now we have no idea where they're having their surgery, and we need that information. The rooming process is horrendous. There's 100 questions to ask the patient, anything from medications to health histories, allergies, do the whole vitals. It took almost the entire visit to get that information before the provider even went in and did the exam. So that was prior to a bright idea that we had here at Northeast, and that was to implement a pre-visit call for those types of visits, and which involved calling the patients a few days ahead of time to ask them some of those same questions. And therefore, when they arrived at the clinic, we were able to give them reminders to bring in their surgery forms. We were able to ask them all the medication questions and kind of tee up the visit. And so when they arrived here, most of the work was done. It takes 2 minutes to room them, take their vitals, and now it's provider turn. So that has worked out very, very well. And one of the things that we really focus on here at Northeast is that we need to create a process that's good enough. If you wait until the process is perfect, you will never get it done. And if you try something and it doesn't work, you move on to the next best thing, and you keep doing that until you find something that works. Bright ideas and innovations and POWs impact the staff as the end result, being feeling more in control of the situation, being able to be more efficient in the clinic, understanding work processes that are used to be difficult or time consuming. So it's actually a very good outcome.